There are medical records that end with a signature. There are some that end with a death. And then there are a few, very few, that do not end at all. They simply stop. No conclusion, no summary, no explanation. Just a sentence that breaks apart, as if the hand writing it was interrupted by something it did not expect to survive. This is one of those records. In the year 1847, Massachusetts was a place suspended between belief and reason. Modern medicine had not yet arrived, but superstition had begun to wear a white coat. Doctors kept journals not for the public, not even for their patients, but for themselves. They wrote what they could not say aloud. They recorded what could not be explained. And sometimes they stopped writing altogether. This particular document was catalogued as routine. No special marking, no warning label, just a thin leather-bound file, filed among hundreds of others, until someone noticed that it had no final page. The file was discovered during a routine inventory of hospital archives, the kind of work done quietly, without expectation. Most of the pages were intact, some yellowed, some stained, but near the end, the handwriting changed. The lines grew uneven. The ink darkened in places where the pen had paused too long. And then, halfway through a sentence, the record ended. No date, no initials, no closing note, as if the act of documenting itself had become impossible. At the top of the first page, written in careful, deliberate script, was a name. Latoya. No surname, no background notation. Just a single identifier, followed by a classification used sparingly in that era. Case requiring prolonged observation. Nothing about the handwriting suggests panic. Nothing suggests urgency, which is precisely what makes what follows so difficult to reconcile. The early entries are unremarkable. Vitals, behavioral notes, sleep patterns. But between the lines, in the margins, in words crossed out and rewritten, there is hesitation. One physician notes that the patient's condition does not progress according to known patterns. Another writes that her responses are accurate, yet mistimed. A phrase appears twice, then is scratched out both times. Awareness without presence. It is never explained. There is no moment where the record announces danger. No dramatic shift. No sudden crisis. Instead, there is restraint, as if the doctors involved believed that describing the situation too clearly might somehow worsen it. One entry ends with a line written smaller than the rest. Further observation advised. Documentation to continue as long as practicable. As long as practicable. The phrase appears nowhere else in the archive. The Latoya case does not begin with terror. It begins with professionalism, with calm handwriting, with measured language. And that may be the most unsettling part, because records like this do not survive unless someone believed They were important enough to keep, and they do not end abruptly unless something made continuation no longer possible. In the next session, we will look at who Latoya was before the record began to change, before the symptoms complicated themselves, before the doctors started choosing which details to leave out. Silence. Before Latoya became a case file, before her name was reduced to ink and observation, she was a presence that went largely unnoticed. And that detail matters, because extraordinary cases rarely begin with extraordinary people. They begin with ordinary lives that change so slowly that no one notices, until it is too late to mark the moment it began. The record provides only fragments. Latoya was young. Her exact age is debated, early 20s, by most estimates. She lived on the outskirts of town, in a household described only as stable and unremarkable. No previous illness, no documented trauma, no religious extremism, no reputation for strange behavior. One line written plainly stands out: patient known to be quiet, but socially appropriate. Not withdrawn, not troubled, just quiet. According to testimony later included in the margins of the record, Latoya followed a predictable routine. She rose early. She completed assigned work without complaint. She spoke when spoken to. There are no accounts of visions, no fits, no erratic speech. In fact, one observer notes, her demeanor suggests attentiveness beyond expectation. The phrase is underlined once, then never referenced again. The earliest changes were not alarming. They were inconvenient. Latoya began pausing before responding, not in confusion, but as if waiting for something else to finish first. When asked simple questions, she would answer correctly, but seconds too late. One family member recalled, she would look at you as though listening, then speak as though remembering. The record does not label this behavior as illness. It simply notes it. In 1847, medicine was confident in its limitations. Women displaying irregular behavior were often diagnosed quickly. Fatigue, hysteria, emotional imbalance. Latoya's early symptoms fit neatly into these categories, which is why, initially, no physician expressed concern. One entry reads, "No indication of delusion or distress. Observation recommended, but intervention unnecessary." The confidence of the line is striking. It would not last. Near the end of the session notes, a sentence appears that does not match the rest. The handwriting is the same, but the phrasing is not. Patient displays awareness not anchored to immediate environment. There is no explanation attached, no follow-up question, no clinical reasoning, just that sentence. It is the first time the record suggests that Latoya is not simply delayed, but displaced. Up to this point, nothing in Latoya's life suggested catastrophe. No screaming, no collapse, No dramatic break from reality, only a growing sense that she was present, but not entirely here. And this is where the record changes direction, because in the next phase, Latoya does not grow worse. She grows different, and the symptoms that follow will no longer fit into any category the doctors recognize. In the next session, we will examine the symptoms that made the physicians disagree, and the first signs that this case could not be resolved by observation alone. Ambient tone fades. Medicine relies on patterns. Symptoms repeat. Conditions escalate predictably. Causes leave traces. The Latoya case is notable because none of these expectations were met. What followed did not resemble illness. It resembled interruption. The next phase of documentation is longer, more detailed, and internally inconsistent. Latoya's physical condition appeared stable. Her pulse was steady, her breathing unlabored, her appetite unchanged. And yet, multiple physicians describe a growing unease during examinations. One entry states, "Patient responds accurately to stimuli not yet presented." The line is underlined twice. No further comment follows. Several notes reference irregularities that are not physiological. Latoya began completing sentences before questions were finished. She would react to sounds moments before they occurred. When asked about this behavior, she did not appear confused. She appeared patient. One physician writes, "Her attention appears fixed on an interval beyond the present moment." The phrase is unusual for its time and deeply unsettling in its implication. More troubling were the physical anomalies. During several observations, Latoya's body temperature dropped without environmental cause. Not dangerously low, not enough to indicate shock, just wrong. When measured again minutes later, it returned to normal. No sweating, no shivering. The record notes this 3 times. Each time, the margin contains the same mark, a small vertical line, used by physicians to flag uncertainty. The most disruptive symptom was not physical. It was silence. Latoya began experiencing periods where she did not speak at all. These episodes lasted hours. She did not sleep. She did not resist. She did not acknowledge questions. Then, without warning, she would resume conversation mid-thought. Not her thought. One entry reads, "Speech resumes with coherence, yet refers to prior discussion not documented." The implication is obvious. She was responding to something no one else could hear. At this stage, the record fractures. Different physicians interpret the same behavior in incompatible ways. One attributes the symptoms to dissociation. Another suggests neurological delay. A third refuses classification entirely. His note is brief. This condition does not deteriorate. It rearranges. He does not sign the entry. It is the only unsigned note in the entire file. By now, the Latoya case no longer fits within medicine. There is no progression, no crisis point, no trajectory toward recovery or death. Instead, there is adaptation. The patient is not losing function. She is gaining access to something the record cannot describe. And it is here, in this unresolved space, that the documentation becomes more careful, more hesitant, because in the next session, the doctors stop describing what Latoya is doing and begin recording what she is saying. What follows will not be diagnostic. It will be remembered. Ambient tone fades into silence. By late autumn of 1847, the physicians overseeing Latoya's case made a rare decision. She would be observed continuously through the night. This was not due to deterioration. There was no emergency, no sudden collapse. The decision was made because too many irregularities were occurring between scheduled examinations. Time itself had become unreliable. The observation room was sparsely furnished. One bed, one chair, one oil lamp. 2 physicians remained on rotation. A nurse was assigned to remain present. The record notes the hour precisely. Observation commenced at 11:17 p.m. This precision will matter. For the first hour, nothing unusual occurred. Latoya lay still, eyes open, breathing steady. She did not appear distressed. At 12:04 a.m., a physician noted, "Patient maintains eye contact with no fixed point." The nurse reportedly adjusted the lamp. Latoya's gaze did not change. At 12:19 a.m., without prompting, Latoya spoke. Her voice was described as calm, measured, unemotional. She said, "You are recording this too late." The record pauses here, not in time, but in handwriting. The next sentence begins slightly lower on the page. The physicians asked her to clarify the statement. Latoya did not look at them. She replied, "The beginning passed while you were still deciding what to call it." No diagnosis was entered. Instead, the physician wrote, "Patient appears lucid, speech organized, content inappropriate to context." That final phrase is overwritten, as if the writer was unsatisfied with how little it explained. At approximately 12:41 a.m., the nurse reported a sudden drop in the room's temperature. The lamp flame shortened. This is not described as dramatic. It is noted the same way one would note a draft. Latoya's pulse was taken. Normal. She then added, quietly, "It's difficult to stay aligned when you keep watching." The physician underlined the word aligned. Once. At 12:52 a.m., the final entry begins. The handwriting is tight, compressed. The physician attempts to summarize. Patient speech suggests. The sentence ends there. The pen dragged slightly to the right, leaving a thin trail of ink. There is no blot, no strike-through, just an unfinished thought. There are no further notes from that night, no discharge summary, no fatality report, no transfer documentation. The record does not state that Latoya died. It does not state that she lived. It simply stops. And in a hospital where everything was documented, that silence is not accidental. In the next and final session, we will examine what happened after the record ended and why the Latoya case was never officially closed. Ambient tone cuts abruptly. When a medical record ends abruptly, there are procedures that follow. Bodies are accounted for. Families are notified. Rooms are reassigned. The Latoya case follows none of these patterns, because after the final unfinished sentence, there is nothing. No addendum. No correction. No explanation written later with the clarity of hindsight. The silence remains permanent. There is no discharge notice associated with Latoya's name. No burial record. No death certificate. In an era where death was documented meticulously, this absence is difficult to justify. Hospital census logs from the following week list one fewer patient than expected. No reason is given. Latoya's name does not appear again. Not crossed out. Not amended. Simply not repeated. Efforts to trace Latoya's family lead to similar inconsistencies. Property records list a residence matching the description provided in early notes. Within a year, the entry is marked vacant. No sale, no transfer. Church registries show no funeral services for anyone bearing her name. No mention of mourning. No communal acknowledgement. It is as though the household was gradually erased from record rather than removed from life. Several months after the final entry, the hospital archives were reorganized. This is not unusual. What is unusual is that Latoya's file was relocated, removed from its original classification, and placed among cases labeled incomplete/non-conclusive. That category contains very few documents. Most are damaged. Some are illegible. None end mid-sentence. In the years that followed, a small number of cases surfaced with superficial similarities. Patients responding out of sequence. Temporal dislocation. Periods of silence followed by clarity. None were formally connected. None progressed as far. And none resulted in the immediate cessation of documentation. The Latoya case remains singular. Whatever happened that night did not leave evidence behind. It left gaps, and gaps in historical records are rarely accidental. They exist because someone chose not to continue, not to look further, not to write what followed. The Latoya case does not conclude. It recedes, and what remains is not a mystery to be solved, but a boundary that was reached and quietly respected. The Latoya case was never meant to be a story. It was not written for an audience. It was not preserved for instruction. It was not framed as a warning. It was a record created by people who believed that writing things down was a form of control. And for most cases, it was. In the mid-19th century, medicine was still learning its boundaries. Doctors knew how to document pain. They knew how to chart decline. They knew how to recognize death. What they did not know was how to respond when none of those patterns applied. Latoya did not worsen. She did not recover. She did not disappear in a way that medicine could name. She simply moved beyond the usefulness of observation. The most unsettling aspect of the Latoya case is not what was written. It is what was not. The final sentence was not erased. It was not corrected. It was not finished later by a steadier hand. It was left exactly as it ended, which suggests that whatever interrupted the writing was not temporary and not forgotten. Historical silence is often mistaken for missing information, but silence can also be deliberate. Sometimes the absence of explanation is itself the conclusion, a recognition that continuing to document would not bring clarity, only exposure. The Latoya case does not ask to be solved. It demonstrates a moment when inquiry reached a threshold and stopped. There are records that end with certainty, and there are records that end when certainty becomes impossible. The Latoya case belongs to the second category. It remains filed, unresolved, uncorrected, not because it was insignificant, but because it went exactly as far as it was allowed to go. And perhaps the most unsettling truth is not that the record ended abruptly, but that no one ever tried to continue it.